So before starting the suturing technique on the simulation model of the silicone sheet, I will introduce in short about the instrument that we are commonly using for suturing technique. So this is a normal needle holder that we are using commonly, but nowadays we are using the smaller instruments and the smaller needle holder. For that we will be using Castroviejo needle holder, Castroviejo scissor as well as iris tooth forceps. So these all are instrument only which we are using for suturing technique. There is no need of extraordinary or so many instruments. So these are very few instruments. It is enough to demonstrate as well as do the dermatosurgery while we are operating on the patient. So in case of Castroviejo needle holder, it is available in 4, 5 and 6 inch of size, and the selection of size will be depending on the size of hand of operator. So if for my hand, this is 5 inch of Castroviejo needle holder and this is 4 inch of Castroviejo scissor. Now the forceps is iris forceps and it is serrated on the blade. So why serrated? Because it helps in holding the margin of the wound. If we hold the margin and if it slip, we have to need to do it repeatedly to hold the margin, and it will create crush injury and trauma to the margin. So the serrated margin will give you ease of holding the margin while we do the fine and precise work. So I will start demonstrating vertical mattress suture. Now vertical mattress suture is same as that of simple interrupted suture. So we have to enter from one side, exiting from another side. So while I land on the skin, my tip of the needle going perpendicular so that I can achieve the depth inside the wound. Now exiting from the probable side on the opposite, taking the needle out. So while I take the needle out, I have to reverse my needle to the opposite direction and holding in the front portion. So while I am doing first prick on the skin, I am holding from the anterior 2/3 and posterior 1/3 junction of the needle. While I am doing near stitches of the vertical mattress sutures, I am holding very near to the tip of the needle, because there will be a precision of work needed while I do the near sutures. So holding the margin, lifting it up and giving the prick of 1 millimeter distance from the margin. So if we can see, there is only 1 millimeter of the distance from the prick from the margin. Taking the needle out, pulling the thread completely, holding the thread and giving 3 loop, 1, 2, 3, holding the second hand and pulling till I close the wound. Then rotation of the thread on right side and left side so that my knot become fixed to the skin surface, it will not slip. Then giving the second knot, third knot and fourth knot. Now this is end of the suturing. I am cutting the thread from 2 to 3 millimeter from the last knot. Now if we see the characteristic of this vertical mattress suture, the wound is closed and the margin is exactly in apposition, while the distance of the far prick is 4 millimeter away from the wound margin, while that of near prick is just 1 millimeter away from the wound margin. Now this suturing is not under tension, there is no much indentation mark, as well as if we can see the wound is closed from surface as well as from inside the wound also. So this is the characteristic of vertical mattress suture that we have to analyze at the end of suturing.